Yeah. Oh, okay, we got you now. Sorry about that. We didn't have audio there to start with. All right, so welcome to the show. Let's jump in and let's talk baseball right off the top. And we've got Yankee starter Marcus Stroman. He's missed a couple of starts on the injured list with knee inflammation. Manager Aaron Boone said that there's still some nerve stuff that is irritating it. Is that normal with inflammation, especially in the knee, to have to have it impacted by nerves, or does that sound like it's a more serious injury to you? Explain what you know about that one.
Yeah, that just sounds strange because nerves bypass the knee, so you could have kind of a nerve problem where the nerve's getting inflamed, or you kind of have a knee problem. It's rare to have both, so it just seems odd. Because there's definitely nerves. Like there's a nerve that goes by the outside of your knee that can get inflamed and can have issues, but then that's a nerve issue. To have a knee problem causing nerve stuff seems to be like we're maybe not getting the full truth. So that's a hard one to know what they're talking about.
All right, I know you're a hockey guy. Let's move on to the NHL and the Stanley Cup playoffs. Avalanche and Stars played a great game last night into overtime. Colorado may be getting some reinforcements back. Forward Gabriel Landeskog, who has not played in the NHL in nearly 3 years due to setbacks with a knee injury. Now, one of the procedures he's undergone is a cartilage transplant, something that no NHL player has ever returned from. We did see Lonzo Ball recover from that in the NBA. Can you talk a little bit about that procedure? Why is it so serious? And does the fact that he's a hockey player, not a basketball player, does that impact how difficult it might be to return from this injury in that procedure?
Yeah, that's a tough procedure. I mean, that's where an area of cartilage has been damaged to the point where you have to take, cartilage for usually a lot of times we use cadaver cartilage and then transplant it directly to that spot. So it depends a little bit where it's located in the knee. My understanding of him was it was underneath his kneecap, which, if you think about the position hockey players are in when they skate in that bent knee position, you really load that joint quite heavily. So that's a tough one to come back from. I mean, basketball's not easy either, but and obviously you can see it's been years. So I'm going to be interested to see just, the guy, is obviously an unbelievable hockey player, but it's been years. And then you have an injury that does make it somewhat unique to hockey. And then it becomes a little bit of a pain thing. So that'll be impressive to see if he can climb the mountain, get all the way back and jump right back into the Stanley Cup playoffs.
All right, let's stick with the topic of knee injuries. The NFL draft, as you well know, is being held this week, Thursday through Saturday. And there was a guy who was looked at as a first-round pick out of Michigan in cornerback Will Johnson. He sat out this past season, and apparently his injury history has been a concern with some teams. He had a knee procedure that was done prior to 2023 that had been bothering him since high school. How big of a deal is it to have a knee procedure done at such a young age in terms of career longevity, in your opinion? Is that a red flag? Should that be a red flag for teams and his future?
I mean, it certainly can be. I guess it really gets into the details of what exactly was done. And then I think I've talked with you guys a bunch on the show just about the difference of, like, if it's a cartilage injury, then we start getting into that arthritis world. If it's a meniscus thing, we can fix a lot of that. But if the cartilage starts getting worn and you have problems there then, and that's why he sat on. I'm actually a Michigan fan, so it was interesting. I didn't know exactly why he didn't play much last year. But if it was a knee problem, that could be, if I was the doctor, again, I'd be a little bit worried. I mean, you'd have to really dive into his exam and his history and imaging and know what was actually done, where is it at now, and then what's the future of progression. And, if it's if there's a cartilage injury or whatever, those are typically progressive. And certainly these guys can deal with a lot, but that would be a little bit of concern for me, depending on what exactly the details are.
All right, you brought up meniscus. That's the injury that J.J. McCarthy is coming back from, had a meniscus tear. He was forced to miss his entire rookie season. Sam Darnold gone. J.J. McCarthy is looked at as the future there with the Vikings in Minnesota. Is there a major concern with re-injury when it comes to a meniscus tear? What types of setbacks, might he be, looking out for as his, his first true rookie season gets underway?
Yeah, I mean, I think my assumption is they repaired his meniscus, and that's why he missed the whole year. Because if you have a knee scope where they just clean out the torn piece, that's usually a much faster return. So if they repaired it, and they deemed it repairable and it's healed, he should be okay. You do worry about the possibility of re-tearing it because, areas that get injured never kind of heal always exactly how they once were. So I'd be a little bit nervous, but if they repaired it and they begin the full year, I think he should probably be good, and then there shouldn't be a major concern with him.
All right, lastly, let's talk about another quarterback, and that is Derek Carr, a veteran quarterback who has been dealing with a shoulder issue. And some NFL insiders are questioning the timing of this injury, how legit it is. But assuming he is actually hurt and this isn't a ploy to try to get traded, what types of shoulder injuries would come to mind for you where you're injured enough that you can't play, you might require surgery, but he's saying he hasn't had the surgery yet and might not get it? There's some gray area there. What does this indicate to you, kind of what you're hearing about Derek Carr?
Yeah, but I would suspect it's some kind of labral tear in the shoulder. The labrum's like that gasket that rims the socket. And that's, you can rehab your way through that. A lot of athletes I take care of, rarely do they need surgery. It becomes a pain thing and then a stability thing. So if it's really obviously causing problems as far as pain and then can't perform, then you get to that tipping point where do we just fix this and be done with it? So I got to think that's what it is. Because if it's a rotator cuff problem or something more significant, that would be one that would really probably push to surgery territory. But the labrum a lot of times is that one that's in that gray area where sometimes you can play with, sometimes you can't.
Yeah, Saints picking 9th in the first round on Thursday. They do seem to be in the market for a quarterback. Could be a landing spot for Shedeur Sanders. We'll have to see how that plays out. Dr. Ryan, thanks so much for coming on. Great insight as always. We appreciate the time.
No problem, guys. Thanks for having me.
All right, Dr. Ryan Smart from SOS joining us here on the show. And with that, we'll hit a timeout. Full lines open the rest of the way. 315-437-7644. We're back after this on ESPN Radio.